in. Hello, my name is Kamisha. I'm a student nurse. I'm going to be doing an assessment on your baby.
Okay.
So can I get the name and date of birth of your baby?
She was born yesterday. Her name's Mary Lou.
Okay. Just a couple questions for you. When was the last time you fed Mary Lou?
I just got done breastfeeding.
Okay, and has she had a bowel movement at all today?
Yeah, she just had both and I changed them.
Okay. All right, I'm going to check the baby's wristband. All right, and that matches up with what you showed me. So I'm just gonna start out with listening and getting my vital signs. Listen to breath sounds bilaterally for a full minute, and they should be between 30 to 60 breaths per minute. And I would check apical pulse. That should be between 110 to 160. Then while I'm listening, just gonna check for vowel sounds, all 4 quadrants. And while looking at vowel sounds, I can notice that the baby's abdomen is rounded, and with palpating, no signs of any tenderness. Then, just gonna get the baby's temperature, axillary. And normal would be 97.7 to 99.5. Right, got vital signs done. Then I'm gonna start out at the head. I'll cover the baby back up. Just gonna check for the fontanelles. So anterior and posterior fontanelles are both soft. I note some of the suture lines are overlapping due to the molding process. Don't see any bruising or scars from birth. I don't see any caput succedaneum, which is just generalized edema over the baby's head. And I don't see the cephalic hematoma, which is just a blood-filled area on the head. So I'm just gonna go down to the eyes. I don't see a subconjunctival hemorrhage, no signs of jaundice in the eyes or any discharge. Each area is 1/3 from the nose to the other eye. Then I would check the outer canthus to the top of the ear to make sure they line up, which they do, so placement of the ears is good. Check the recoil bilaterally of the ears. Instant recoil. Then I would check patency of the nares, so cover one nostril and then the other. And then with my gloves on, I would check the hard and soft palate in the baby's mouth, and then also check the sucking reflex. So then I go down, check the neck for any masses, which I don't feel. Then the baby would probably be moving around, so I could note that they have appropriate range of motion. Go down and check the clavicles. They are intact. I don't feel anything broken. Then while I'm down here, I'm just gonna assess the skin. There's 5 areas known for jaundice, so it'll be forehead, chest, abdomen, and then the baby's thigh. Then we go back and check at the eye, which would be a later sign, which I don't see. So the baby's overall appearance is pink. I don't see any vernix at all, no lanugo noted, and I don't see any birthmarks. Just look at the arms as well. Everything looks good there. And I could also check the baby's skin turgor, and it's immediate return, so that looks good. I'm just gonna check the baby's hands. It has multiple creases, 5 fingers, multiple creases, and 5 fingers on that side as well. Then I'm gonna check the legs, also no bruising or scars or any other skin findings. Multiple creases on the feet, 5 toes, and multiple creases, 5 toes. Then I'm gonna check the genitalia. So for a male, I would check to make sure the testes have descended. I will also check the scrotum for rugae, and there should be multiple rugae on the scrotum. And then the penis with the urinary meatus should be in the middle on the tip, which that looks good. If the baby was circumcised, I would check the foreskin. And then for female, I would make sure the labia majora covers the minora. And if I notice any discharge at all, that would be normal due to the birthing process from the mother's hormones. Then for the umbilical cord, I would just check to see if there's any crusting. If there is, it can just be wiped off with like a washcloth, but otherwise you wouldn't have to put anything else on it. I'm going to check the baby's reflex on the feet, the Babinski reflex. And the toes should fan out. That would be a normal finding. So you just make the J, and the toes should fan out. And then I can also do the Murrow reflex while I have the baby in this position. So I'm just going to clap, and the baby's hand should fan out and make a C shape. And then also while I'm here, I can check for the 5 signs of distress from a baby. So she could have nasal flaring, grunting, retractions, apnea greater than 20 seconds, or the seesaw respirations. So we definitely want to make sure we pay attention to that. Then I'm going to turn the baby over, assess the skin on the back. I also don't see any bruising. I'm going to check the spine, it's midline. There's no dimple or tuft of hair, so that looks good. Okay, I'm going to cover the baby back up. Do you have any questions for me?
No.
No? Okay. Alright, if you notice any changes in your baby, just be sure to press your call light, or if you need anything else from us, and then we'll be able to stop in for you.
Okay, thank you.
Yeah, you're welcome.